But tonight our focus is on the big vaccination drive. The countdown has begun for the country's corona vaccination drive that is scheduled to begin on the 16th of January with health workers across the country. Today, Prime Minister Narendra Modi spoke to chief ministers across the country in a video conference. Mr. Modi assured them of the centre's support, said the vaccinations in this first phase would be free of cost, and insisted that there would be no side effects. Just listen in first to what the Prime Minister said, and then we'll have the key points persons telling us all the key FAQs. Take a look.
बड़ी बात जो मैं दोहराना चाहता हूं कि हमारी दोनों वैक्सीन दुनिया की दूसरी वैक्सीन से ज्यादा कॉस्ट इफेक्टिव है। हम कल्पना कर सकते हैं अगर भारत को कोरोना टीकाकरण के लिए विदेशी वैक्सीन पर पूरी तरह निर्भर रहना पड़ता तो हमारे क्या हालत होते, कितनी बड़ी मुश्किल होती, हम उसका अंदाज लगा सकते हैं। ये वैक्सीन भारत की स्थितियां और परिस्थितियों को देखते हुए निर्मित की गई है। एक और बात जिस पर हमें बहुत गंभीरता से काम करना है, हर राज्य, हर केंद्र शासित प्रदेश को ये सुनिश्चित करना होगा कि अफवाहों पर वैक्सीन से जुड़े अपप्रचार को कोई हवा न मिले। इफ्स और बट्स से बात नहीं होनी चाहिए। देश और दुनिया के अनेक स्वार्थी तत्व हमारे इस अभियान में रुकावट डालने की कोशिश कर सकते हैं। कॉरपोरेट कंपटीशन भी इसमें आ सकती है, कंट्री का प्राइड के नाम से भी आ सकता है, बहुत सी चीजें हो सकती हैं। ऐसी हर कोशिश को देश के हर नागरिक तक सही जानकारी पहुंचाकर हमें नाकाम करना है। इस चुनौती का पूर्वानुमान लगाते हुए ही बीते महीनों में भारत ने बहुत व्यापक तैयारियां की हैं। कोरोना की वैक्सीन से अगर किसी को कुछ असहजता होती है तो उसके लिए भी जरूरी प्रबंध किए गए हैं। यूनिवर्सल इम्यूनाइजेशन प्रोग्राम में पहले से ही इसके लिए एक मैकेनिज्म हमारे पास रहता है। कोरोना टीकाकरण के लिए इसको और मजबूत किया गया है। साथियों, देशवासियों को एक प्रभावी वैक्सीन देने के लिए हमारे एक्सपर्ट्स ने हर प्रकार की सावधानियां बरती हैं और अभी साइंटिफिक कम्युनिटी की तरफ से विस्तार से हमें बताया भी गया है। और आपको मालूम होगा, मैं इस विषय में जब भी मुख्यमंत्रियों के साथ बात हुई, मैंने हमेशा एक ही जवाब दिया था कि इस विषय में हम जो भी निर्णय करना होगा वो साइंटिफिक कम्युनिटी जो कहेगी वो ही हम करेंगे। साइंटिफिक कम्युनिटी को ही हम फाइनल वर्ड मानेंगे और हम उसी प्रकार चल रहे हैं। कई लोग कहते थे, देखे दुनिया में वैक्सीन आ गई, भारत क्या कर रहा है, भारत सो रहा है, इतने लाख हो गया, इतना हो गया, भारत कुछ, ऐसी भी चिल्लाहट हुई। लेकिन फिर भी हमारा मत था कि ये साइंटिफिक कम्युनिटी और जो इसके लिए जिम्मेवार लोग हैं उनकी तरफ से जब आएगा तभी हमारे लिए उचित होगा और हम उसी दिशा में चले हैं।
So the Prime Minister claiming that the scientific community will take all the major decisions on this vaccination drive. Remember, as this vaccination program is on the horizon, starts on the 16th of January, Serum Institute in Pune, its vaccine, Covishield, has already taken the lead. The government today has reportedly signed its first order with the Pune-based institutes for 11 million doses in this first tranche. Those doses have already begun to get shipped to different state capitals across the country. Our correspondent Pankaj Kherkar was on the spot in Pune to watch the vaccines beginning their journey. Take a look.
The vaccine is here. The Serum Institute of India is shipping the first batches of Covishield as India gets ready to kick off the world's largest vaccination drive from January 16th. Around 10 million doses of the vaccine that will provide protection against coronavirus will be shipped in the first tranche. The first shipments are to Gujarat, Haryana and Madhya Pradesh. The transportation is being managed by Pune-based cold chain firm Coolix. The company has a fleet of 400 such air-conditioned, temperature-controlled and GPS-fitted trucks across India. Much of it will be put into service for the vaccine mission.
We are very happy to get this prestigious contract from various clients of ours to transport these vaccines in temperature-controlled environments all over India. It's a very big day for India. It's a historic day because the Indian government is starting the largest vaccination drive in the world, and we are very, very happy to be part of it and very excited right now.
In addition to Covishield, Bharat Biotech's indigenously developed Covaxine will also be added to the vaccination drive. It is awaiting phase 3 trial results. The two vaccines will first be dispatched by air to government medical store depots at Karnal, Mumbai, Chennai and Kolkata. From these depots, the vaccine will be transported to 37 state stores and 29,000 cold chain points in truck. From these cold chains, the vaccines will be finally sent to districts and primary healthcare centers.
Now in the first phase, Serum Institute's Covishield vaccine will be dispatched to 8 cities in 3 states, that is Gujarat, Madhya Pradesh and Haryana. All of the 6 refrigerated trucks are GPS fitted, and armed police personnel are also traveling with these trucks to provide security till these trucks that are carrying Covishield vaccine reach their destination. With Cameron Gopal Harne and Samir Sheikh, this is Pankaj Khelkar in Pune for India Today.
So let's get a sense of all the big questions that still swirl around the vaccination drive that begins this week. I'm joined by Dr Vinod Paul, Member Health at NITI Aayog, but crucially, this person who's in a sense supervising this entire rollout. Appreciate your joining us, Dr. Paul. Dr K Srinath Reddy is also joining us from the Public Health Foundation of India, one of the country's leading epidemiologists and public health specialists. I want to come to you, Dr. Paul, first. Am I to understand all systems go after what the Prime Minister said today when it comes to the date of 16th of January? That's the date when you're going across the country?
Yes, indeed. I think it's a very important day today when you see these trucks moving out of the factory, taking vaccine, the precious vaccine, the life-saving vaccine to various parts of the country. So it is really the green signal today. And the Prime Minister today reviewed the entire effort and shared ideas, shared the vision, shared the details with the chief ministers of the various states today. So indeed, a very important day today. And yes, indeed, the preparations have reached a point where the states are ready to roll out the program at the district level, at the sub-district level, and at the block level.
Let's come to specifics, Dr. Paul. Am I to understand that the priority is the 1 crore health workers in this first phase starting the 16th? Because what we are told is that Serum Institute, the order placed with Serum Institute is for around 11 million doses. Now, assuming that it's a 2-dose vaccine, that doesn't cover this entire, does that cover the entire first phase or only half of it? Would it cover around 50 lakh workers?
Well, these are two different things, Rajdeep. One is that there is a clear commitment to overall cover 300 million people or 30 crore people in the first big wave of vaccination program for the priority groups. We must remember that, and there is a lineup of rollout and stock availability in that context. Now, you are beginning with the very first phase of this wave, and that first wave is focused on about 1 crore health workers, 81 lakh of whom have already been listed in our system, the CoWIN system. And the first orders have been placed. This is the very first order. This is not even the second order or the final order. And there is assured availability as we visualize on this vaccine as well as other vaccines in the pipeline, and particularly Bharat, which has already provided the authorization. So it is just the first order. Other orders will follow, but the vision and the lineup is very clear to us.
No, but when you say first order, what I wanted to understand is on the 16th of January, will all those who are vaccinated across the country get only Covishield, or will they also get Covaxine? Because at the meeting today with the chief ministers. The prime minister apparently said that the allotments will be made of different vaccines to different states. So will it be a mix of Covaxin and Covishield, only Covishield? What can we expect in this first week when the vaccination drive begins?
Well, the first phase itself will have both the licensed vaccines to be rolled out. And at this point in time, yes, the orders are being placed. Both these vaccines will be used.
So you are still confident, can we say with absolute confidence, that Covishield and Covaxin are being treated on par? Because there has been a lot of controversy over whether Covaxin, because clinical 3 trials are still ongoing, is at the same level of readiness as is Covishield?
Well, for the purpose of the rollout plan and for the coverage, yes, both these vaccines will be used. We are working out details as to how different vaccines have to be placed in various geographies or populations. That detail will follow. But yes, indeed, both the vaccines will be used.
Dr. Srinath Reddy, let me get you in for a moment. Does that make you feel comfortable that both vaccines, as Dr. Paul said, will be part of this initial rollout, even though the fact is that in the case of Covaxin, clinical 3 trials are still ongoing?
Well, Rajdeep, there are 3 perspectives, and we'll have to reconcile all the 3 perspectives. First is the pure scientist perspective, which says that we would need a completed phase 3 trial to be absolutely confident about the efficacy. The second is that of a health system manager who would say that if mutant strains are entering and there is a potential for...
Okay, yes. Okay, we'll try and... We'll try and come back to you because our source has frozen, but I want to come to you while we await to get back to Dr. Reddy. Dr. Paul, there was another question mark which today's meeting of the Prime Minister with the Chief Ministers didn't fully address, and that's on pricing. We are told that in the first phase, with 1 crore health workers and later 2 crore frontline workers, the Prime Minister assured the state Chief Ministers that the vaccine will be free of cost. Am I correct? That it is only for the first phase that the vaccine will be free of cost for the 1 crore health workers and the 2 crore frontline workers. After that, we don't know.
Well, you should interpret what the announcement is. The announcement is very clear that we are entering the first phase, which has 2 components, health workers and frontline workers. And for these 3 crore individuals, the entire cost of vaccination program is being borne by the central government. That's it. Beyond this, the government will take a decision and will share the decision when the time comes.
But isn't that, in a sense, Dr. Paul, with due respect, in a way, going against the grain of what was suggested to the country earlier, especially during the Bihar elections, where it was suggested that everyone would be getting the vaccine free? Number of state governments, Madhya Pradesh, Tamil Nadu, Bihar, all said the vaccine will be given free. Now what is being suggested is only these 3 crore workers, the health workers, frontline workers, are guaranteed a free vaccine. The rest, 27 crores in your first phase, we don't know.
The point is, the decision today relates to the vaccination program for 3 crore individuals. The decision for the rest will be taken in due course, and you don't have to presume decision one way or the other. Allow the time to pan out, and the decision will be communicated.
What I'm trying to understand, Dr. Paul, is therefore, are we saying that the government at the moment is only focused on the 3 crore health workers and frontline workers? What happens after that depends on the success of this first phase.
It should not be put in this manner. What we are saying is we are beginning with the very first phase involving 3 crore people, which is a very large number of people. This is, a population of several countries, for example. So you begin here, you are then ramping up your preparations, you're ramping up the supplies, and you will move to the next phase in a matter of weeks. It's not going to be long. It is just the very start. And as you would expect in any program of this nature, that learning phase, both in terms of managerial aspects, in terms of satisfaction of the people, and so on, will pave way for a much larger escalation that we expect in a matter of weeks. Indeed, the learnings will be paving way for something that we do on a much bigger scale. But we must make an assured beginning. It's very important that the beginning is assured, the systems function, and it is a great beginning to start with healthcare workers and frontline workers. But remember, it is a continuum. It is not that you are not thinking about the next phase. The next phase preparations are on. The infrastructure issues, the IT system, the stockpile, vaccine, all that is there in the works. That program is out there in the system, but you have to begin with a certain finite program. This is the very beginning of the larger program.
So can I then try and understand that this 3 crores will that program, you said, in a matter of weeks. So are we saying that, let's say by the first week of February, that's 3 weeks after the program, the vaccination program begins, all the healthcare workers will get their first shot? Is that the hope?
Well, it's probably not very accurate right now to pinpoint the exact date, but certainly we are working with, as many as 5,000 vaccination points right away. This will be doubled up or more in the medium term in a matter of weeks, and then perhaps going further. So allow us to build up the whole process in an effective way, in a significant way, and then scale it up to a totally different level, which will be multiple of the original effort with many times.
Okay, Dr. Reddy, we lost you there for a moment. You were trying to make the point about how different scientists are looking at Covaxin and Covishield, both being part of this initial process. You want to complete the point?
Well, I said there are 3 different perspectives which need to be reconciled. First is that of a pure research scientist who would like to see the efficacy trial completed and data fully available in order to come to a judgment and then allow the vaccine to be put into motion. The second is that of a health system manager who is concerned that mutant strains have now emerged which have entered the country, and a vaccine like the Covishield, which is only directed against the spike protein, might become ineffective, though it's not certain as yet, but that potential exists. And therefore, going for a vaccine which has many more antigens and therefore is capable of having a more broadband immune response, which the virus with the spike protein mutations will not be able to evade. And also possibly looking at the need for giving an inactive virus to those who are immunocompromised or immunosuppressed, in whom even a vector virus like the adenovirus, which is otherwise innocuous, might become hazardous. So because of a variety of these reasons, it is possible that the health system managers may want to have this in reserve. Third is the perspective of the political decision maker, who is concerned that after all, it is a licensed vaccine from an international vaccine that is now being made in the form of Covishield, and large supplies may not be available for this huge population. So why not go ahead with another vaccine on the basis of whatever evidence is available? It is difficult to reconcile all of these, but obviously some decisions have to be made. I would have been happier if we had a complete phase 3 trial, but now that the decision has been taken by the regulator that immunogenicity data is adequate at this point, let us hope that the phase 3 trial too would be completed as soon as possible and we get a result.
But you know, Dr. Reddy, the Prime Minister today said that he will go by what the scientists say. That's fair enough. But as you said, some of the scientists are concerned about the fact that the efficacy of the phase 3 trials is still up in the air. Therefore, from the 16th, there will be certain states which will get, as per allotment, Covaxin, other states which will get Covishield. Now, I am being told by doctor friends that there are some doctors who are skeptical about getting Covaxin. So, what happens to their skepticism? Do we completely override it? Is the political decision actually, in the end, overpowering the scientific decision?
Well, basically, I think the regulator and the scientific committee that has advised the regulator has to take the responsibility for the decision. Now, it is entirely up to individuals to decide whether they would like to receive the vaccine, which has not yet passed the phase 3 trial test, or go for the other vaccine whenever it becomes available, or wait for the phase 3 trial to be completed and then take a call. But I suppose once the regulator has given the permission, whatever be the circumstances under which the permission was granted, I think now the process has begun, and we'll have to hope that it will be completed as soon as possible in terms of meeting even the phase 3 requirement. But the process has begun.
But two issues are arising from that, Dr. Paul. Number one, is it mandatory for the health worker to take the vaccine, or is it her or his choice?
Well, Rajdeep, no vaccine is compulsory. Obviously, it is voluntary. But it is in the interest of the individual to take vaccine for himself or herself, for his or her family, because health workers are exposed to situations where the risk of contracting infection is higher. Their families are worried. And therefore, this group has to be protected. All the country are focusing on this group as a priority. This is, in a way, a norm. Having said that, we must remember that, yes, we have emergency authorization for 2 vaccines. All the vaccines, including Pfizer and Moderna, are emergency use authorizations in a special circumstance. And our vaccines have shown great immunogenicity, including T-cell immunogenicity, as well as shown a great safety over thousands of individuals. I also want to emphasize that, yes, it takes a while in emergency situations to every viewpoint, but the overarching sentiment in the country among the doctors is to go for it. Today, the Indian Medical Association, which has as many as 3.5 lakh members and 1,800 branches, have come out with a press release where they are calling upon their members to take the vaccine, either of the 2 vaccines, and they are praising the decision of both the vaccines.
No, I take your point. I take your point that the overarching sentiment is to take the vaccine, but let's put it this way, Dr. Paul. I'm a doctor in Karnataka. Karnataka is allotted Covaxin, not Covishield. I don't want to take Covaxin, I want to take Covishield. Do I have that choice? I don't have that choice, do I? Because the allotments are being made centrally, presumably, by you and others. So Karnataka, does a doctor in anywhere in the country have that choice as to what vaccine I want to take?
Well, the decision of which vaccine goes where will be taken by the Ministry of Health and communicated to the state government. Now, the population which is offered vaccine A has the choice to take it. If they don't want to voluntarily take it, I suppose it is their choice. But we believe that healthcare workers who know the health issues more than others will overwhelmingly accept the decision. And they'll have faith in the decision taken by our regulator and overarching, favored overarchingly by the scientific community. We are not living in, a situation which is a normal situation. It's a pandemic situation. And in that situation, decisions are based on the new frameworks within the scientific system and the regulatory system and the global and national norms.
I again concede that, and I know that the Prime Minister today said there can be no ifs and buts, but the fact is that given the speed with which certain decisions have been taken, there are some ifs and buts, Dr. Paul. I just want to understand, what if there are people who develop side effects? Who is accountable? The state government, the center, the actual manufacturer?
Above all, one thing which is very certain is that these vaccines have very little side effects. This is very evident. Both have been tested over thousands of individuals. Have no doubt about it that these are absolutely, as safe as any vaccine can be, barring a little pain here and a little, fever, perhaps minimal fever in some individuals, not in all. So it's among the safest of the vaccines, and no serious side effects are there. This is for sure. It is also for sure that both of these excite huge and very definite, deep, comprehensive immunity, both at the antibody level as well as the T cell level. Now, if we are going forward with this, if the side effects occur, there is a system of accountability. This system has been built on our experience of universal immunization program, which we have mastered over a period of time. We had it in operation during the polio times. And this again is aligned to global frameworks, the WHO frameworks, and so on. There is a system how it will be reported, how it will be responded to, at what level it will be reported to the Drugs Controller General of India. And also remember, both the makers of the vaccines have also in parallel a system of pharmacovigilance, which is a so-called state, post-marketing surveillance system that is an institution. And therefore, there is a formal watch and regulation oversight over the rollout as well, which will be informing us about how the situation pans out and what we witness as the side effects. And therefore, it is as robust as it should be, and we should be having confidence in our system. I plead with all of us that have confidence in our systems. These decisions are taken in the larger public health interest. And as I have said, I'm happy to take the vaccine that my turn comes for, whichever vaccine it is. And I'm very happy to take the Bharat Biotech vaccine. In fact, I'll prefer, in a way, if I have a choice. But if I don't, I'll take whatever is available to us. I have faith.
Interesting. You're saying that you will take whatever vaccine you're given. You're ready to take the. In fact, you would prefer to take the Bharat Biotech vaccine, is what you're saying, Dr. Paul. You want to respond, Dr. Reddy? Would you be as comfortable taking whatever vaccine you're offered?
Well, Rajdeep, I know that Bharat Biotech vaccine is safe. Whether it is efficacious or not is a matter of interpretation, whether we accept the immunogenicity data or wait for the clinical trial data. Now, if I am offered the Bharat Biotech vaccine, I'll certainly take it. And if it comes out in March that it is ineffective, then I'll again ask for the other vaccine. But at least in terms of being offered and accepting the vaccine, whatever is given, I'm willing to go with it because it's a safe vaccine.
No, it's a safe vaccine, but as you say, it may not be effective in March. Then what happens? Then you go back to the drawing board?
Well, no, one doesn't need to go back to the drawing board because, firstly, as I said, I too wish the phase 3 trial was completed. If the phase 3 trial is going to be completed in March and doesn't show the efficacy, then it would only mean the inconvenience of revaccinating the people who received the Bharat Biotech vaccine. And that is something that would have to be done in any case under those circumstances to protect them. But at this point in time, I believe that the government is proceeding with the assumption, based on the regulator's view of the data, that there is sufficient promise of efficacy based upon the immunogenicity data, which will translate also into the clinical efficacy.
Okay.
As a purist, one might want the clinical trial to be completed, but now that the operation is on for whatever reasons of urgency, then I think we'll have to go by the fact that it is a safe vaccine with efficacy still to be completely proven, but assumed on the basis of immunogenicity.
Let me ask you, Dr. Paul, in conclusion, the Prime Minister today said that VVIPs cannot jump the queue. Am I to understand that in the first phase, none of our mantris, our big netas are going to get the vaccine, bureaucrats? It's only going to be focused on health workers, on young doctors, on frontline workers, they will be the entire focus? No one will jump the queue?
Yes, entire focus of the first phase, the immediate phase, will be the healthcare workers, sanitation workers, municipal workers, the people who are on the front lines in pandemic control and in serving the medical services, the healthcare services. Yes, that is the decision, and the Honorable Prime Minister has underlined when other groups would be entitled for their vaccination.
And you're going to be in the first group, presumably, Dr. Paul?
I don't know. I don't know. If I am, I'm happy. I'm a doctor. But if you think I'm in the system and I'm not a doctor, no problem. I wait for my turn.
My young son is a doctor, so he's looking forward to it. And I know that a number of doctors who've been working on the front line are looking forward to it. So I hope it works out. I'm willing to suspend my journalistic skepticism today and wish you, Dr. Paul, and your team the very best. You have a huge challenge ahead. Cold storage chains, online registration, all in place.
I appeal to our nurses, doctors, healthcare workers to come forward. It is the beginning of the end of this pandemic, and we have to provide the lead and come forward, take the vaccine, we need it.
Okay, Dr. Paul and Dr. Reddy, clearly you have set the stage for what promises to be the next big leap forward, in a sense, in the fight against coronavirus. We hope the vaccine is as successful as you claim it will be. We wish you all the very best. Dr. Paul?
Rajdeep, if I make one point,
yes.
One brief point.
Yes, please.
While the sequence of vaccination is absolutely appropriate at this point in time, one additional group may have to be addressed in case needed. If it turns out that the mutant that has entered India is now beginning to actually create many more cases in some hotspots, then to put down those hotspots, those areas too need to be prioritized for early vaccination. So apart from the health workers, other essential workers, and of course those with comorbidities, we will have to also look at potential hotspots and then put them out through early immunization, and that is a priority that needs to be kept in mind.
You want to quickly respond to that, Dr. Paul, that in the geography of this vaccination, are you looking at the hotspots first?
Well, as of now, most hotspots are settling down. But the point Dr. Reddy has made is essentially to say, watch the behavior of the pandemic, watch particularly for escalation of the mutant strains. And if that occurs and a scientific strategy for scale-up has to be revised, it'll be taken into account, and we are alert to the situation in a very dynamic way. So thank you, Dr. Reddy, for that suggestion.
You know, I just want to tell you, by the way, Dr. Paul, this has been sent to me by a retired bureaucrat, and you may want to respond. For the vaccine to be truly successful, few VIPs should first offer to take the vaccine. In the US, their president-elect was the first to offer, and a police officer also, retired IPS officer, is saying, we would like the ministers also to take it first. Do you think there's a... how do you respond? What would you like to tell them, Dr. Paul, that these are former IPS and IAS officers saying that they'd like ministers also to take it first?
Well, the ministers should hear it. The VIPs should hear it. But definitely having people leading by example is a very sensible idea, a very useful idea. We all value such initiatives, and I think that point is well taken.
So is there a possibility, because Parliament starts end of this month, before Parliament all our 545 or 543 MPs take the vaccine as well, and the 200 odd of the Rajya Sabha? They're not in your first list, right?
First priority, as the Honorable Prime Minister has clarified once and for all, are the frontline workers and healthcare workers.
Okay. I think you've made that very clear here today, Dr. Paul. Thank you so much for joining me, along with Dr. Reddy, giving us a perspective of what promises to be the major challenge in the weeks and months ahead. Thank you both so much for joining me here on the news today. Let's take a break at this point. When we return,